Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Leading with Love, a physician's guide to clarity and compassion. Jessie, welcome back to the show.
Delight to be here.
All right. What's this latest article about?
So, this latest article is actually about something that is really my super passion. And I wrote it now because it's something that we just need in medicine and the world right now, if that makes sense. Also, because I gave a TED talk on it in the fall. And so it's something that, because it's about love, and I think in medicine, we're a little like hesitant about approaching things that way. But now it's out there in the world, so I might as well share it more broadly. And I think what I have found is this tool is actually most effective in medicine and is something that we really need in healthcare and in the world right now because it is this sort of unifying, clarifying way of showing up with compassion when things don't make sense and healthcare doesn't make sense and the world doesn't make sense right now. And so this is a way of filtering these really difficult decisions and finding clarity when we can't use those tools that we were taught in medicine to find clarity.
All right. So tell us a little bit more about this. What does it mean to lead with love?
So, what it means to lead with love is filtering your decisions through essentially heart-based decision making or love-minded decision making. And I like to think of love, it's not self-sacrifice, it's not martyrdom, it's not, in some cultures it's couched that way, but that is really people pleasing and martyrdom and all of these other things. It's not actually love. So love is honest and courageous and direct. It doesn't do things that cause you harm, essentially. Just like in medicine, we take an oath to do no harm. If you lead from a place of love, you're literally doing no harm to yourself and others. And what it does is it doesn't also disregard the data. Like I think sometimes people say, well, if you're going to lead with love, you won't pay attention to the studies or the evidence or the science. And actually, it takes all of that, but filters it through this lens of humanness and the complexities and nuances of being human and perhaps different opinions and different ways of approaching things. And it gets us out of that sort of angsty fighting energy, and it's more of a peaceful, calm approach. I really see it as a clarified approach. And I have seen this approach work for people in the ER. It works for people whose parents are, end of life care. It gets us out of all the other noise about what should I do or what I'm supposed to do, or in the healthcare system, what other people should do or how it's supposed to be. And it really gets into this lens of what is most caring for you and for those you care for and for the system.
In your article, you shared a very personal story that guided you to this particular approach. So, if you feel comfortable, share that story with us and how did that lead you to this conclusion?
Yeah. So the story, which I shared in the article, and I shared it in my talk also, and it's really what I would say is a universally resonant story because we all have these moments in our life where they shift the way we see the world. And so the story that I shared is that about 10 years ago, I was a busy physician leader with 3 kids and multiple leadership roles and a full practice in a big healthcare system where we worked fast and furiously. And I had a job that I loved, but my husband developed some pretty significant depression. And when that happened, it was sort of the tipping point. So all the balls that I had been juggling were hard to juggle. And ultimately, I ended up taking time off. And this was after I spent a very long time trying to do the things that we do in medicine. So fix everything, manage everybody, get him the right care, make sure my children weren't going to have long-term complications and everything was going to work out okay. And what that got me was just in more of a snarl. And so I ended up actually taking time off, which for physicians is a really hard thing to do. And in that time off, I went to yoga, and I don't know if listeners here know, but I also teach yoga as a result of this experience. And it helped me regulate my nervous system. It helped me sort of pause and breathe and completely shift my perspective. And so what I realized is that in this more calm state where you have access to inner knowing that you cannot have when your brain is spinning, which is where we live most of the time in healthcare, I was able to see solutions that I couldn't see otherwise. And what became clear was that my husband was actually neurodivergent, which is amusing because I'm a pediatrician who diagnoses autism all the time, but I didn't see it in my own house until I really slowed down, and I hadn't slowed down until that point. And what happened with that is that once I explained to him what it was, he was like, oh, yeah, well, that's clearly what's going
Mhm.
on. And that's clearly kind of how we got down this road of managing things. We were a doctor, lawyer, family with three
Mhm.
kids living in the city, doing all the things. And it gave us paths of approach that were different and ways of relating to one another and ways of seeing our differences that weren't me sort of understanding explaining it in the way that my brain worked and actually to have a much more open, kind, compassionate perspective, which this same tool, right, applies to when we work with people in healthcare. It's really seeing things not through our medical lens, but through the human lens. And so, in that whole saga, I will call it, is where this question really began to serve me. And what I found is that it actually works so well everywhere else. It works well with your teenagers. It works well with your aging parents. It works well as a healthcare leader where there are things that are just inherently in conflict or inherent differences. And in our relationship case, it was inherent differences in the way that our brain worked, that you can then find common ground in those because love is common ground and it's sort of common humanity, something that Kristen Neff talks about. So when we find that common ground, we can more easily see solutions to difficult problems. So if it's an end of life care decision, you can ask the same question, love-based decision making. What would love do for this person, for their inner family, for the outer family, for the world? And you can kind of go the whole way out. Where I think we in healthcare really struggle is we always leave ourselves out. We're happy
Mhm.
to express love, compassion, whatever it is for everyone else. But you have to include yourself in this, or we get bogged down in those same patterns of over functioning and over giving. But when, heart-based and love-based decision making and really leading from a place of love, which is what we're all about in healthcare anyway, potentially easier for me because I'm a pediatrician, so it lends itself to that. But this works, in any specialty, that it is clarifying when there are all these nuances and conflicting pressures, even around, as a leader, budget or scheduling, or, love would not leave it unstaffed,
Mhm.
but love would not have one person do it all. It can kind of get at these nuances and outside the box creative solutions. Sometimes love sets a boundary and says, we need per diem, and, nobody here can do it.
Yeah.
That will cause harm. It allows you to advocate in a more effective way.
Do you feel that sometimes physicians mistake the concept of love for sentimentality, vulnerability, and weakness?
Yes, absolutely. Absolutely. And I would say that, real love or love-based decision making, it isn't sentimentality. It's not, that's the rom-com TV version of love. And in some cultures, love is the self-sacrifice, martyrdom, giving all, and we couch that as love. But if you look at sort of what is actually love is this universal, positive, do no harm, do help one another as human beings energy. And so what I'm encouraging here is really tapping into that. For some people, you might couch it as heart-based decision making. And there was a book in Vietnam written a while back, and I met this lovely physician with a Vietnamese background who shared this with me, that there was a movement there to have hospitals be called houses of love. And there's a book about hospitals as houses of love that was written during the revolution. And to me, that's this idea that,
Mhm.
like, what if the energy of a hospital healing was about love? It would be so different than our current hospitals, which are about efficiency and money and moving people through as quickly as possible. And I think it's just always remembering, and it's funny because, that physician and leadership training is run so deep. I'm like, well, but it doesn't mean that you don't do the important things, because
Mhm.
love wouldn't have a non-functional hospital. Love wouldn't provide terrible quality of care. It just wouldn't, it helps you navigate the nuances of the costs on all sides and how can you do it in a way that we're not sacrificing one party versus the other. It takes the conflict out of it.
Give us an example where a physician would approach what you're describing, leading with love, asking what would love do, and having it solve a typical clinical
Yeah.
problem or a conflict in the physician workplace.
Yeah. I mean, the easiest one is the late patient. And this is sort of a not emotional one, but I find it really helpful, especially for women physicians who have this conflict and maybe they have to pick up their child. And, our training says you see them and no matter when they come and you put the patients first. But love wouldn't necessarily do that if your kids were waiting or were
Yeah.
going to be left unattended or you're going to have to pay $20 a minute, right? So the idea is what would love do about this late patient? And sometimes you'd see them because maybe you can fit them in, but sometimes you don't see them because all your other patients have to wait or you have something urgent at the end of the day. It also opens up this idea that, say it's somebody who has transportation issues or really has to be seen that day. You might ask for help. It gets you out of that sort of guilt, blame, shame conversation. Similarly, you can use it end of life care. I've seen physicians use it in the ER a lot because there are just these really complex, nuanced decisions about where to be or again, like what level of care to offer. Or we're often put in situations in healthcare where there's like no good choice.
Yeah.
And so when you lean into this sort of human spirit and human compassion, leading into that, that can tell you where to put your energy, how to get help. Do you call in someone extra? How do you manage the budget? I would say I had a physician once whose healthcare organization, they lost about 50% of their doctors in their clinic. And this was a situation of night call. And so the people left were still covering all the nights. And in that case, Love would give them a deadline, 2 weeks. You got to find someone. This is, we can't take call every other night just because we're short staffed. And again, that's loving for you as a human being because
Yeah.
that's not sustainable. It's actually also loving for the patients because they're not going to get good care eventually and something's going to happen and nobody will have your back as a physician. And it just gets you out of the challenge of like, is this a problem with me problem that I can't handle this every other night call? And when you advocate from that energy, it's also much more effective. As physicians, we advocate from injustice and this shouldn't be, and we're being badly treated. And that's not usually the winning argument, right? And so even if it's true and even if it should be different, but I think when we advocate from this place of, and for some people, they'll shift it to kindness or compassion and whatever word works for you. I really do wish the world would lean into love. I think this idea of like, imagine if we made decisions in healthcare
Yeah.
and we paused and we took a breath and had this sort of thoughtful connection to the energy which you want to make the decision from, then you get that kind of result. And that's what a coaching tool that I work with people on. If you make decisions from fear, you get answers that lead to more fear. You don't get good solutions. And so that's where this filter of love-based decision making can help you navigate really tricky situations.
And I want to emphasize that leading from a place of love doesn't necessarily mean saying yes to everything. It's a
Oh,
way to
yeah.
definitely set boundaries, right?
Yes.
And have
Yeah.
that self-compassion, right?
Yes. It allows you to say no, actually, but not from a place of anger and from a place where it costs you a lot to say no. I think we have this movement of say no and establish boundaries. And for many of us in healthcare, that is tremendously costly. It drains us. We're anxious about it. We feel shame and guilt about doing it. And we have a lot of inner conflict. I think when you make a decision from this love-based decision making, which is the greater good and a world that you would like to see, then that sort of washes away and it allows you to show up in a much more authentic, aligned place.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Leading with Love, a physician's guide to clarity and compassion. Jessie, as always, let's end with take-home messages that you want to leave with the Kevin MD audience.
The most important thing here is to recognize the energy by which you're showing up and choose that with intention, letting go of these all previous sort of pre-held notions of what you should do and leaning into this positive, do no harm energy. And that filter, while it might seem fluff and it might seem like it's going to disregard some things that you hold dearly, love doesn't do that. And
Mm.
so we ultimately are here to heal in healthcare, and leading with love and compassion allows you to do that from a place where you're not bypassing what matters most to you.
Jessie, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure.